Legislative priorities are an area of focus for an organization's federal advocacy efforts. Having legislative priorities helps ensure that a group's core values are represented on Capitol Hill. They tell Congress who an organization is and what they believe in. Each year, the RPA determines its legislative priorities in consultation with our lobbyists and RPA's Government Affairs Committee. The priorities are based on the concerns of our membership. RPA's priorities are divided into two categories. Tier 1 action briefs include front-burner issues that RPA wants Congress to address immediately. Tier 2 information briefs provide RPA's positions on other key issues. These may be found online at www.renalmd.org and can be used to educate lawmakers and offer additional background on these key issues. Appropriate compensation for nephrologist services has been RPA's #1 legislative priority for many years. We believe the current formula in the Medicare fee schedule that determines how doctors are paid is flawed. During the past 5 years, temporary fixes have ensured that doctors aren't taking a pay cut, but Medicare payments haven't kept up with inflation increases in many years. RPA, along with the rest of organized medicine, is seeking a permanent payment fix. While the regulators and legislators believe a fix is needed, it will be challenging to identify both the mechanism and funding to reform the payment system. Further, Congress historically has been reluctant to fix the payment formula without creating a quality improvement program in Medicare. Opponents of such change believe that pay-for-reporting and pay-for-performance programs are not ready for implementation. If RPA can convince Congress to support a permanent payment fix, the result will be stable and predictable funding. With this funding, nephrologists will be able to devote more resources to improving quality patient care. Another RPA action brief focuses on the Kidney Care Quality and Education Act of 2007. Right now, actual payment for dialysis services does not match the cost of providing the care. However, with the passage of this bill, there would be an annual increase in the composite rate payment for dialysis facilities. Increases would be tied to a quality performance incentive payment demonstration program. This program includes quality measures reporting and eventual bonus payments. RPA wants congressional support for this act because this federal funding would support kidney patient education, safety, and access. It would also promote innovation in kidney care and provide for retaining trained, qualified staff. RPA believes that to appropriately perform quality reporting, nephrologists need the right kind of health information technology. That is why RPA has included health information technology as a legislative priority for 2007. Enacting comprehensive health information technology legislation is expected to help reduce healthcare costs and improve quality care. Access to health IT will help facilitate the ability of many more physicians to implement online quality reporting programs in their offices. Through passage of comprehensive legislation, Congress can facilitate the widespread use of health IT for physicians, dialysis chains, and small-level providers. This is a new priority for RPA, but a very important one given the recent national focus on quality improvement. During the past few years, RPA has made a concerted effort to become more proactive in the advocacy arena. We are getting our message to legislators and regulators on behalf of nephrologists and other members of the renal health care team. Some of these efforts include hiring 2 full-time staff members to work at both a national and grassroots level to influence legislation and regulations, hiring a Washington, D.C. lobbying firm that represents our interests on Capitol Hill, creating a political action committee to support legislators who share RPA's views on major issues that affect nephrologists, nephrology practices, and kidney patients, providing expertise on key issues affecting nephrology and kidney patients for congressional staff through, for example, Capitol Hill Symposia, and joining Kidney Care Partners, a coalition of consumer, provider, industry, and professional organizations so the kidney community speaks with a unified voice. RPA members can advocate for RPA's legislative priorities in many ways. Contributing to the RPA PAC facilitates the ability of RPA leaders and staff to have lengthy face-to-face interactions with senators and representatives. Through the voluntary support of RPA members, RPA PAC can help elect or re-elect candidates who share RPA's views on major issues that affect nephrologists, nephrology practices, and kidney patients. RPA PAC can also help RPA respond to changes affecting nephrology practice that are the result of legislative or regulatory action. RPA has learned that members of Congress and candidates do not forget those who have supported them in their campaigns. Participation in RPA's grassroots network facilitates the ability of RPA members to interact with their elected representatives in real time, weighing in on issues under consideration by congressional committees responsible for overseeing the Medicare program. Developing a relationship with your congressional delegation is a critical part of letting lawmakers know how healthcare policies affect their constituents. RPA members are able to send urgent online messages to our elected representatives through our legislative action website, CapWiz. It is vital that we take advantage of each of these opportunities to raise the profile of nephrology and our issues of greatest concern with our elected officials. RPA members can visit our website to learn more about our legislative priorities. If you have more detailed questions or if you are interested in becoming a part of our grassroots efforts, do not hesitate to contact us. RPA is at the cutting edge of nephrology practice. RPA is nephrology's preeminent voice on Capitol Hill. Join us so your voice can be heard in the halls of Congress.